Hey everyone, and welcome. Today we're diving into a condition that honestly hides in plain sight in a lot of pediatric clinics: abdominal migraine. You know all those kids with recurrent tummy aches? Well, this is a super common cause, but it often gets mistaken for something else. So let's jump right into this clinical primer and figure out how to spot it. So here's our game plan. First, we're going to broaden our whole idea of what a migraine can even look like in a kid. Then we'll lock down the specific definition of abdominal migraine, walk through exactly how to diagnose it, see how it stacks up against its clinical cousins, and finally, we'll look at what the future holds for these young patients. All right, first things first. When I say migraine, you probably immediately think of a monster headache, right? But in peds, we have to completely reset that thinking. The migraine spectrum for kids is way, way broader. And believe it or not, it often doesn't involve the head at all. And this, right here, is the question you'll be asking yourself in the clinic. A kid shows up with this awful, recurring belly pain. Your mind is racing. Is it gastroenteritis? Constipation? Something more serious? But what if the real problem isn't in their gut, but it's actually coming from the migraine circuitry in their brain? That's the challenge we're here to figure out. To really get this, we need to talk about something called episodic syndromes. Basically, the International Headache Society groups conditions like abdominal migraine and cyclic vomiting syndrome together. Think of them as potential precursors to migraine, or even just different flavors of it. The key is that they're distinct, recurring episodes, with the child being perfectly healthy in between. Okay, so with that background, let's get super specific. Let's define abdominal migraine. What exactly are we looking for when we see these patients? Here we go. The official definition has two parts, and both are absolutely crucial. First, you've got these recurring, pretty intense episodes of pain that are right in the middle of the abdomen. Second, and you have to catch this in the history, the child is completely 100% normal and symptom-free between these attacks. If that pain is always there, even a little bit, you've got to think of something else. And look, it's not just about the pain. To officially make the call, that pain, which can last for hours or even a couple of days, has to come with at least two other symptoms. The big ones are a total loss of appetite, nausea, vomiting, or the child just looking really, really pale. So if you see a kid who's pale and refusing to eat along with that belly pain, your abdominal migraine antenna should be going way up. And don't think for a second that this is some rare, once-in-a-career diagnosis. Nope. Abdominal migraine is actually pretty common. We're talking up to 4% of all kids. In any busy pediatric practice, you are absolutely going to see these patients. The only question is, will you recognize it? This chart here gives us a massive clue. Just look at that peak. The typical age when this all starts is between 2 and 10 years old. That's your sweet spot. So when a school-aged kid comes in with this pattern of symptoms, abdominal migraine needs to be way up high on your list of possibilities. Okay, so we know what it is, we know who gets it. Now for the important part. How do we actually diagnose it? Let's walk through the practical, step-by-step process you can use every day. This is pretty much your diagnostic checklist. Are the episodes happening over and over again? Check. Is the pain midline and bad enough to stop them in their tracks? Check. Do they have at least two of those other key symptoms like nausea or pallor? Check. Are they totally fine between episodes? You have to ask this. And finally, have you made sure you're not missing some other GI or kidney problem? Check. Now, this is a point I really want to drive home. You cannot order a blood test. You can't get an MRI that's going to say abdominal migraine. This diagnosis is made based on your clinical skills, your ability to take an amazing history and do a solid physical exam. The story the family tells you is everything. And just to be crystal clear, this is a diagnosis of exclusion. That means your history and your physical exam have to be completely reassuring. There shouldn't be any red flags pointing to something like inflammatory bowel disease, an obstruction, or a kidney stone. If your exam feels off at all, you've got to keep looking for those other causes. All right, so here's where it can get tricky. Often, the biggest challenge isn't ruling out something surgical, but telling abdominal migraine apart from its really close relatives in that whole episodic syndrome family. You know, the easiest way to think about this is to ask, what is the dominant symptom? What's the main event? If the headliner is just intense, nonstop vomiting, you're probably looking at cyclic vomiting syndrome. If the number one complaint is that awful midline belly pain, that's our abdominal migraine. And of course, if the headache is the star of the show, well, that's a classic migraine headache.
Each one has a single symptom that's always there.
This table really drives home just how much these overlap. I mean, look at pallor. That paleness is super common in both cyclic vomiting and abdominal migraine. And you'll notice kids with abdominal migraine can still get headaches and throw up. It's just not the main feature. Something else that's really interesting is the age of onset. It tends to creep up as the main symptom moves from the gut to the head. About 5 years old for cyclic vomiting, 9 for abdominal migraine, and 11 for the classic migraine headache. So what happens to these kids in the long run? This is such a critical question, especially for counseling families. Let's take a look at the typical patient journey and what you can tell them to expect. So, the first bit of good news you can share with parents is that the stomach pain itself usually doesn't stick around forever. For most of these kids, these specific abdominal attacks will start to fade away and pretty much be gone by the time they hit their early teens. But the story does not end there. And this next piece of information is probably the single most important clinical pearl in this entire explainer. 70%. Just lock that number in your brain.
That's right. 70% of kids who you diagnose with abdominal migraine will eventually develop typical migraine headaches later on. What that means is you're not just diagnosing a recurring tummy ache, you are actually making an early diagnosis of a future migrainer. The problem doesn't go away, its manifestation just shifts from the gut to the head.
And that brings us to our final thought. The next time a kid walks into your clinic with a story about these awful recurrent belly aches that just don't seem to fit any other diagnosis, I want you to ask yourself this question. Because by recognizing abdominal migraine today, you're not just helping them now. You're providing better counseling, better guidance, and ultimately better care for the future adult with migraine they're likely to become.